We're here with Odelia Mirzadeh in Beverly Hills. She is a speech and language pathologist. Odelia, can you tell us what exactly a speech and language pathologist does?
Sure. A speech and language pathologist, otherwise known as speech therapist, works with people who have speech and communication disorders. What that entails is having language disorders such as expressive and receptive language, being able to communicate your needs or understanding the needs of others, having speech impediments such as fluency, apraxia, dysarthria, misarticulation such as lisps. And another aspect is auditory processing deficit, being able to process the information that you've just gotten and knowing what to do with that information. And another part of our field is also working with feeding deficits.
And what makes your practice different from a lot of the other speech and language pathologists?
Over the course of the years, I made sure to take various different continuing educations and learn about different therapy methods that are out there. And having learned those different methods, I combine all of that in my sessions daily. So I may use the Hanen, I may use floor time, I may use prompt or oral motor or apraxia, and I'll combine all of that into the same session as opposed to just see one child on a specific method. And when I do that, I get them to engage.
What would you say to parents who suspect that their child may have speech and language issues? What would you advise them to do?
If there's a message that anyone can walk away with is, as early as your child is born, ask questions, research, study, talk to doctors, talk to your schools, talk to speech therapists, and really just get to know your child and get to know how they're the same and different. How are they communicating that's the same, and how is it that they're not communicating the same or on the same level as their peers are? A lot of times, children are unfortunately misdiagnosed, or they're not diagnosed at all. Not necessarily by a certain syndrome, but the fact that they're just delayed, or they're not communicating, they're not up to par with how they should be. And ask questions, really go out there and research.
Sophia was speech delayed, severely speech delayed at 2, and we got services. We came to Odelia last July when Sophia had no words, no sounds, and within 2 months Sophia was able to make 10 sounds consistently, which was amazing. And since then she has about a vocabulary of about 70 words, and she's doing it on her own with minimal prompt and a lot of prompting for other words. She goes up to people and she says hi. When we go to hikes, she's very approachable, but when she wasn't able to talk, she would just go and grab people really tight, and people would not know what's going on. But now she says hi, and then she wants hug, and she says hug, and people tend to respond really well with that. So we've been very, very happy with Odelia since then.
If somebody needs to get in contact with you, what is the best way to do that?
They can either email me at odelia@innovativeslp.com, or they can reach us via phone. That's 310-486-1717. And they can also find us on the website under www.innovativeslp.com.